Good evening and welcome back to the Canadian Concussion Center's webinar series, which is sponsored by LIUNA, the Laborers International Union of North America. I'm really pleased to announce we have Dr. Robin Green tonight, who's going to be speaking to us. Dr. Green is a clinical neuropsychologist and senior scientist in cognitive neurosciences at the University Health Network, Toronto Rehab, and the Saunderson Chair in Acquired Brain Injury. Her program of research addresses brain and behavioral mechanisms of recovery from traumatic brain injury. Her lab has focuses on neural, cognitive, and mood functioning in the chronic stages of mild to severe brain injury in order to develop evidence-based treatments. The lab has identified novel, modifiable, that is treatable targets and is developing targeted treatments to improve memory outcomes. Dr. Green and colleagues founded the Kite Telerehab Center for Acquired Brain Injury, a provincial center for care that is integrated with research, where patients across the province receive remotely delivered cognitive and mental health interventions pro bono. Patients range from months to decades post-diagnosis. The center fills a significant gap in clinical care for chronic brain injury. Dr. Green completed her PhD at Cambridge University and her clinical neuropsychology training at UHN in Toronto. And with that, I'm going to turn it over to Dr. Green.
I'm going to talk to you today, as Dr. Rattan said, about persisting problems with attention, speed of processing, memory, and executive functions. Here's my disclosures, no conflicts of interest. Okay, so here's an overview of the presentation. I'm going to talk about these different cognitive functions, what they are, and also how they manifest or how they show up in a person's everyday life. I'm going to talk about what causes or worsens these thinking problems. I'm going to speak about the special role that attention plays in contributing to other cognitive problems. Then I'm going to talk about something called the good old days bias, which you may have heard of. And then I'm going to talk a little bit about treatment or management and some evidence-based interventions. And Leslie, feel free, maybe you could give me like a 3-minute warning.
Will do.
Okay, thanks. All right. So what I put on the left are the symptoms and some of the subcategories, and then everyday life examples. So attention and concentration, I'm going to spend a bit more time talking about that later on in the talk. Includes focusing attention, dividing your attention, sustaining attention over time, shifting between two things, going back and forth, and selecting your attention and filtering out background noise. So if you have a problem with that in your everyday life, what might that look like? It might look like you're kind of zoning out, or it can look like you're forgetful. It shows up as distractibility, difficulty following conversations, or repeating questions and having difficulty learning new things. Processing speed it can refer to processing of verbal or language information, or it can refer to visual processing. And it can also refer to how quickly we can scan things, like scanning across a page, how quickly we can read. And often processing speed, we can feel that slowness. Sometimes we can't, but it just turns up as we're taking more time to get things done. Learning and memory. So we talk about, in broad terms, input, storage, and output. So we have memory for or learning and recall of on an immediate basis, so something we've just learned maybe a few seconds ago or a few minutes ago. What we call, as neuropsychologists, as long-term memory refers to anything that's over a few minutes, and much longer information that comes from a lot longer ago we call autobiographical memory. We can have something called there's something called perspective memory. So that's remembering to remember or remembering to do things like take your medications or remembering to go to an appointment. And as I said, we can talk about input or encoding, as well as consolidation of that information into our memory versus retrieval or the output of that information. And problems in everyday life. So forgetting some instructions you've been told, forgetting a conversation you heard, also can turn up as just not following through because you've forgotten what you were supposed to, that someone asked you to do something, for example. Executive functions. Executive functions refers to a constellation of capacities, including multitasking, problem solving, working memory, which refers to holding information in your mind's eye, and that can be verbal information or visual spatial information. It includes planning, organizing. It includes being free from impulsivity. So impulsivity is what we would call a dysexecutive symptom. Inhibition or disinhibition being the dysexecutive problem. It involves controlling or regulating our emotions and also judgment. So what can that look like in our everyday life? And that, we commonly have problems with executive functions after concussion. We might interrupt more. We might come across as very impatient. Could also show up as just not being able to get going or get started in your everyday, or not being able to follow through on things, complete tasks, not following someone's advice. When it comes to things like controlling emotions, it might look like someone might lash out more, lose their temper, get into arguments. And we can also feel overwhelmed by volume with problems with executive function. So, of course, these symptoms have all kinds of implication in our everyday life. They have implications for being safe driving, bicycling, all kinds of sports, implications for being able to return to school, work, implications in social situations, being able to just navigate social situations comfortably and well. And of course, these symptoms can impact our relationships, personal and work relationships. So I'm going to talk now about the causes, but also the kind of perpetuators of cognitive problems after concussion. So, of course, cognitive symptoms can be caused by the direct organic effects of concussion. So the effects of concussion on the brain, which we think of as a functional disorder. We don't think of concussion as causing damage to the hardware, but we sometimes talk about it as damaging the software or compromising the software. And as you probably know, we can have there are different ways in which the brain can get concussed. It can be either due to direct impact or a blow to the head, or it can be caused by the exertion of forces on the brain. And you don't have to hit your head to sustain those acceleration, deceleration, or rotational forces to the brain that can cause a concussion. We can get that if we're even a belted passenger or driver in a car, for example, when there are significant forces on the car that causes our brain to lurch forwards and backwards or to rotate. And prior concussions makes things worse. We have more significant concussion symptoms, and they're slower to recover when we've had prior concussions. Okay. So what I'm really going to focus on are the indirect causes of ongoing concussion symptoms. So, and by this, I'm referring to things like sleep disturbance or fatigue, which end up causing us cognitive symptoms, not because the concussion necessarily caused direct effects to cognition, but rather having poor sleep, even in the absence of concussion, as we all know, can cause symptoms, cognitive symptoms. And so if the concussion is causing sleep disorder that can in turn cause cognitive symptoms. Or if we sustain cognitive symptoms from the concussion, if we are having poor sleep, that can exacerbate or worsen those cognitive symptoms. And that's what I mean by indirect causes. And so the same holds for headache pain or other pain, for symptoms of depression and anxiety, medications, substances that have an impact on thinking, neuroendocrine problems, and attention problems, which I'm going to come back to. So, so again, these other factors might have been present prior to the concussion, or they may have emerged since the concussion. So, for example, the headache that is contributing to the cognitive symptoms may have existed before the concussion, or it may be a consequence of the concussion. But in either case, it's making cognitive symptoms worse. And so that's what we call the vicious cycle of concussion. You have an injury, and let's say the injury causes cognitive symptoms, and the cognitive symptoms in turn increase symptoms of anxiety. And the anxiety cause somatic symptoms like sleep problems, for example. And those in turn worsen the cognitive symptoms. And you can, these arrows run in both directions. So the injury might cause somatic symptoms like fatigue or pain, and that in turn causes the cognitive symptoms, which in turn cause mood symptoms and so forth. So that's what we call the vicious cycle of concussion. And a lot of what we place emphasis on in terms of trying to help people to recover from concussion and to alleviate the cognitive symptoms of concussion is breaking that cycle of concussion. And I'll come back to this, breaking that vicious cycle of concussion. Okay, so I said I would talk about the special role of attention. There are many different types of attention, as I mentioned before. There's selective attention, which you can think of as the gatekeeper. You focus on one thing, you filter out other background noise. Sustained attention, which is staying focused and resisting distraction. Attentional shifting, or dividing attention. So focusing between two tasks, let's say jumping back and forth between two things, multitasking. And then there's working memory, which also is considered an executive function. And that's the ability, as I mentioned before, to hold information in your mind and to work with it or manipulate it. And attention is special because it underlies all other cognitive processes. And it's also special because it's controlled by neural networks that are distributed right across the brain. So, and the fact that it's distributed and spread out makes it more vulnerable. So it's more susceptible to fluctuations in our physical and our mental state. And anything that might decrease the brain's processing efficiency, like poor sleep, fatigue, a cold, etc., that can have an impact on attention. So attention is really vulnerable. And then attention has this impact on other cognitive processes. So you've got attention, which can be disrupted by all kinds of things in our life, as I just mentioned. And then you've got the fact that attention plays a role in all our other cognitive functions. So for example, for memory, we have to maintain our attentional focus to take in and learn new information. And we also have to focus when we're trying to retrieve information from memory. When it comes to language, holding information or ideas in our mind when we're having conversation, or when we're reading, involves attentional functioning. And in terms of executive functions, we need to pay attention to hold information in our mind's eye for our emotional well-being too, even. We don't really think of attention as playing a role in emotion regulation, but you need to be able to filter out and not focus on upsetting content, for example, and negative ideas that make us continue to ruminate. So we're more inclined to ruminate when our attention isn't functioning as well. So how can we improve our attention? We can improve our attention by maintaining our physical health, by treating other factors that affect attention, sleep, mood, and pain. I'm going to come back to this again. And even by just identifying the freshest part of the day. So if there are things that you need to get done, it's important to address all of these things, and that will in turn have an impact on your overall cognitive functioning. And as I say, I'm going to come back to this further in a few minutes. And I want to talk now about something that's called the good old days bias. You may have heard of this. It's an interesting phenomenon, and it's going to sound intuitive, but it's very important in concussion. So what the good old days bias refers to is overestimating our capacities before the concussion. We sometimes call this misattribution errors. So for example, before my concussion, I never forgot where I left my keys. I never had trouble remembering a person's name or remembering my PIN for my bank machine. I never had word finding problems, a word on the tip of my tongue that I couldn't pull up. I never had any difficulty dealing with a complicated problem. I never felt like I couldn't finish my homework. So that's this idea that we have this idealized version of how we were before, and that can cause us to over-attribute problems we have after concussion to the concussion. But in fact, we can never know the actual cause of any given error, any given slip in any situation. So if I've had a concussion and I'm driving and I go out to the parking lot and I can't find my car, I can't know if that is due to the concussion or whether that's just, what we call whether that's just a kind of error in our cognitive functioning that might have happened in the absence of the concussion, or it might be attributable to being tired or distracted, but have nothing to do with the concussion. And why does it matter? Well, it matters because over-attributing symptoms to concussion, over-attributing our cognitive problems to concussion, can increase our symptoms of stress, anxiety, depression, and that helps to perpetuate the vicious cycle of concussion. So I just wanted you to be aware of that. I'm always really, cautious when I'm talking about the good old days bias, because it can sound like we're not appreciating the true impact of concussion on everyday functioning, and that's definitely not the case here. It's just highlighting this issue of that we can make these misattribution errors, and that can make things worse for us. So it's good to have awareness of that bias that we sometimes have. Okay, so now I'm going to, talk about management and treatments for concussion, and I'm going to talk about evidence-based approaches. So as I said, I'm going to focus on the indirect causes of cognitive symptoms. So the first thing I'm going to talk about is what we sometimes call the low-hanging fruit. So headache or pain, sleep, and mood. Really important to address these indirect causes of cognitive symptoms to help to break that vicious cycle. How do we do it? Intuitively. First, try to gain self-awareness. Self-evaluate those symptoms: sleep, fatigue, pain, stress, anxiety, mood, depression. Evaluate what what the symptoms are, there are some tools, there are some resources, the Living Concussion Guidelines, especially for prolonged symptoms, that you can use to do that. And then we always talk about taking a symptom-based approach, just tackling each symptom on its own. For sleep, there are a variety of treatments that have nice efficacy. So insomnia, cognitive behavior therapy, good sleep hygiene practices. You can talk to your GP, of course, about medications or sleep study as needed. For pain, again, medications, I'm talking about any kind of pain, including headache pain, which can be very debilitating and is a really common consequence of concussion. Of course, you can try over-the-counter medications, and then mindfulness and pacing, which I'll talk about in a moment, are really important interventions that have known effectiveness for pain. For stress and mood, cognitive behavior has nice evidence behind it, mindfulness meditation, psychotherapy. Again, you can talk to your GP or your nurse practitioner about medication, and you'll be hearing more about stress and mood and these treatments for mental health after concussion from both Dr. Snyderman and Dr. Rattan. Another approach or another intervention is called the 4Ps, and this is for energy conservation or fatigue. And this is about managing your energy to help your brain and your body to rest. And it's also, it's concerned with conserving physical and mental energy to help you to improve your cognitive functioning, your ability to get things done every day. So prioritize, pace, plan, and position. Prioritize what is the most important thing. Is the activity urgent? Does it have to be done today? Is it important? Does it have to be done in the next few days? Is it somewhat delayable? Let's say until your cognitive symptoms start to abate. Does it have to be done this week or month? Can it really wait? Or is it something that you don't ever have to do, or is it something that someone else can do for you? So these are all intuitive, but it's valuable to use this structure when you've got a concussion to try to prioritize. So this is something to bring to mind when you've got a concussion to help you get the most out of your days. So that's prioritizing, planning. What are you going to do? When are you going to do the activity? And keep in mind that it may take more time. And how are you going to organize your activities? When do you feel the best throughout the day? What else do you need to do during the day? Pacing, the third P. How are you going to do it? So take breaks when necessary, break down tasks into smaller chunks, and spread out your tasks throughout the day. And lastly is position. Where are you going to do it? What's the environment? Are there going to be distractions in your environment that are going to consume more of your attentional resources to filter out? Even your body position. Are you going to be standing or sitting when you're doing your whatever task you need to do? I'm going to talk about now a couple more interventions that have nice evidence behind them. One is mindfulness meditation, so good evidence for cognitive functioning. So mindfulness meditation entails focusing on being aware of what you're feeling in the present moment and without any interpretation or judgment. And I suspect you're going to hear about that from Dr. Rattan, who knows a lot about this. We have mindfulness-based stress reduction, mindfulness-based cognitive therapy. There are really nice demonstrated benefits of mindfulness meditation for sustained attention. Also, demonstrated changes to brain structure and function. And mindfulness also improves those indirect causes of cognitive symptoms like anxiety, stress, pain, and depression. There are many apps out there that you can find with guided meditations, and some are free and some have a small cost. Okay. And another approach that has really nice efficacy behind it is called goal management training. And this focuses on executive functioning in particular. It's an interactive program. It improves high-level attention, planning, organization, and follow-through. And just to tell you a little bit about goal management training, or GMT, one fundamental problem when we're trying to achieve a goal or to manage our goals to get something done, a fundamental problem that we can have in managing our goals is failing to stop and to examine the elements of the task and to know what we are doing in a given moment. And one of the fundamental aspects of GMT is just to provide strategies like the stop technique to tackle that, to bring you back into the present moment, figure out where you are, what you're doing, and keep you on track so you don't get off track. Another fundamental problem in managing goals is not having control over attention, being absent-minded. Slipping into, if you think about autopilot, think about highway hypnosis, where you just kind of zone out, and that resulting forgetfulness from slipping into that state. So again, goal management training has really nice interventions and strategies to help you stay on track with tasks, to be more productive and to not slip into that state of absent-mindedness or that kind of autopilot state. Some other approaches that have nice evidence for concussion recovery and in turn cognitive symptoms: physical exercise or subthreshold exercise, which you're going to hear about from Dr. Bailey. Subthreshold exercise is probably the only intervention that has demonstrated efficacy for speeding up concussion recovery. But in general, physical exercise is great for our brain, and it's important for concussion, even outside of the specific sub-threshold exercise protocol that I'm referring to. Physical exercise actually causes the proliferation of new neurons in the brain. And for brain health more generally, neuroplasticity, which you'll have heard of, is the capacity of the brain to change, to rewire itself based on experience. And something called environmental enrichment, which is related to use it or lose it, promotes that neuroplastic change and healthier aging. And so engaging in mentally effortful activity, so activity that's continuously novel, challenging, effortful, engaging, intensive, is really beneficial for brain health. So what can you do there? Learn something new, like learn a new instrument, a new language, build something. So you want to think about doing things that have those properties of novelty, challenge, effortfulness, etc. Okay, so some takeaways for you. So cognitive impairments can manifest in complicated and sometimes unobvious ways in everyday life. And I'm flagging this for you, and I'm flagging it for the people around you, because it's that the symptoms manifest in unobvious ways, because sometimes we don't. I was talking before about over attributing things to concussion, but sometimes we can under attribute things to concussion. We don't realize that some of the ways that we're behaving, like zoning out, for example, might be attributable to attentional problems that are tied to concussion, or that we're suddenly cursing more or getting into arguments when we didn't used to, and that's attributable to emotion regulation problems tied to concussion. And it's really important for us to have awareness of this so we can manage these symptoms in our everyday lives. There are direct and indirect causes of persisting cognitive symptoms after concussion. So effects on the brain, in contrast to indirect effects of cognitive symptoms that are due to pain, fatigue, attention. Attention plays a disproportionate role in all aspects of cognition, and it is distributed across the brain, and it can be disrupted by both physical and mental health factors, and it's really easily disrupted because of the way that it is distributed across the brain. And remember that we need intact attention to have intact memory and intact executive functioning. Misattribution errors, the good old days bias, overestimating our capacities before the concussion, or over attributing our errors to the concussion can increase our stress, our worry. Management approaches, I didn't say this explicitly, but there isn't any magic bullet for concussion. So we know that subthreshold exercise can help a little bit, but there's no magic bullet that's going to get rid of your concussion. It's important to address the indirect causes. And there are some nice interventions for the cognitive symptoms when we have prolonged cognitive symptoms, like goal management training, mindfulness medication. Physical exercise or subthreshold exercise can speed up concussion recovery in general, including our cognitive symptoms. And we can enhance our brain health, for example, through environmental enrichment. So Leslie, I didn't get a 3-minute warning, but I think my time is up, and I don't think I ran horribly over,
No,
right?
that was perfect. Yes.
Okay.
Thank
So I'm
you
gonna,
so much. That was fantastic.
great.
Okay, I'm going to kind of flip back and forth because it looks like there's a few questions that we received in the chat as well as in the Q&A. Okay, so Jim is asking, can something be learned through genetic testing that might be useful in treating people with TBI?
That's a really interesting question. So there is research that's been done on particularly ApoE4, I think it is. And there's some evidence that people that have ApoE4 have poorer outcomes from concussion, but I am not sure that there's any evidence that in an individual, that if you were to get at the individual level, if you were to have general genetic testing, that it would be helpful to you at this time. That may be something that's useful going forward. But there is a lot of research going on it.
Great, thank you. Okay. Margot is asking, I would be interested to hear Dr. Green's thoughts about 40 hertz light and sound stimulation and Vi-Light. So this sounds like a product, Vi-Light Neuro Duo 4 and the Vegas for treating persistent symptoms.
Right. Okay. So I think you're talking about blue light therapy, if I'm not mistaken. And I think Jenny Ponsford, who's a researcher in Australia, has done some research on that, showing that there is evidence for efficacy of that. I suspect that's what the 40 hertz is. I'm not 100% sure. I can look that up. So I would say yes. I don't know. Was the second part sound therapy?
Sound stimulation, yeah.
Um,
It sounds like maybe this product is, yeah, both sound and light.
yeah, it's so interesting. I mean, we're really, I think we're at the earliest stages of understanding how this kind of stimulation of brain waves can influence recovery. There's really interesting basic research, more in the area of moderate to severe TBI by Alberto Pascal Leone in the US on this topic. And I don't know, do you like, I can send papers to Christiane or you, Leslie, and you could maybe provide them at the next, or we could put them on our
Mm-hmm.
website on the
Mm-hmm.
topic.
Yeah.
I think we're still at the earliest stages, so I don't know of any evidence-based intervention for anything other than light therapy at this point.
Great. Thank you. How do attention difficulties differ from direct cognitive dysfunction?
Okay, so thank you for that question, because sometimes people talk about attention versus cognitive function, and attention is a cognitive function. So if I suggested in my talk that attention isn't a type of cognitive functioning, that I misled you, because it is. So it's just that it's a particular, it is a, a foundational cognitive function that underlies other cognitive functions. It's similar to speed of processing, and some people would say that to some extent attention and speed of processing are even interchangeable. But it is a cognitive function. So does that answer the question? You can respond in the chat if
Mm-hmm.
I'm not answering your question.
Great. Thank you. The next question is, are there any games or apps to improve cognitive functioning?
Great question. So, I shout out to my student Sadna, who's on here, who has been studying this a little bit. Um, so, um, and I just remembered an intervention that I should be talking about. I'm going to mention it after I finish my answer. So, there are a whole bunch of brain games out there that have been critiqued by the scientific community for making claims about the benefits to concussion that unfortunately don't have good science behind them. But I would say the app that has the best science behind it is called Brain HQ. And for people, not for people, so the main issue is that when you're looking at the impact of these um, apps and brain games on people who don't have any injuries to the brain or disorders of the brain, but are just trying to enhance their cognitive functioning, that's where there's some unfounded claims. But when it comes to people who have had a brain injury, including a concussion, there is demonstrated efficacy by Brain HQ. So I like that one the best.
Mm-hmm. Great. Thank you. And
Okay,
just to
so the other
oh, sorry.
So the
Go
other
ahead.
thing that I should have mentioned in my talk is something called slow-paced breathing. Sadhna's doing a big systematic review of this, and when it's done, hopefully it'll be done before the end of your webinar series, and we'll give you the results of it. But slow-paced breathing seems to have some nice efficacy for in people in the absence of concussion. So it's not really been studied much in concussion, but in the absence of concussion, it's showing efficacy for aspects of cognitive functioning, as well as those things that impact cognitive functioning, like our mental health, stress, and emotional well-being. So slow-paced breathing is something else to consider. I see a heart came up. Does that mean that somebody likes slow-paced breathing? I
Somebody
bet
must
that
like,
it's
maybe
probably
that's Sadna.
Sadna.
Yeah.
Okay.
Excellent. Thank you. And just a reminder to everyone, if you do have a question, please put it into the Q&A as opposed to the chat if you can. Someone is asking, I'm assuming comparing the cardio exercise versus resistant training. That's all it says. So I'm assuming they're
Okay.
wondering whether one is better than the other for cognitive functioning.
I'm going to leave that for Mark Bailey, who's going to talk about physical exercise, and I think he can give you the latest. I know that's kind of under debate whether resistance gives you the same benefits as cardio. I don't think you can do the sub-threshold exercise. I shouldn't say that. I don't know of literature on the sub-threshold exercise protocol, so the Buffalo concussion protocol, using resistance, but it may have been looked at.
Great, thank you. David is asking, he had a concussion in a motor vehicle accident and is now having post-concussive symptoms. It sounds like a lot of life changes, unable to work, insurance denying disability. And he's asking what testing is required to prove persistent cognitive symptoms?
That's a really important question. And Leslie, feel free to jump in on any of these questions too. It's a tall order to prove it. That's one of the problems is that we don't see it on imaging. We don't see it on conventional imaging, typically. So we don't typically see lesions in the brain. And in older adults, or not older adults, but once we start to get into middle age and older, the things that that turn up as that can be a sign of concussion can also be conflated with normal aging. So white matter hyperintensities on MRI. When it comes to neuropsychological assessment, unfortunately, neuropsychological assessment was designed for more significant cognitive problems. And so the problem is if you have, let's say, decline from the 75th percentile to the 25th percentile on a test, which is a huge drop, 50 percentile points, you're still in the normal range. So it's hard to really definitively say that, in a neuropsychological profile, it can be hard to say that someone definitively has prolonged symptoms of concussion. So there's a full picture that is clinically taken into consideration that is tied to a person's history, their occupational functioning, their neuropsychological performance, where we look at not just a person's absolute level of functioning, like their percentile score, but we look at it against benchmarks of estimated pre-injury functioning. Like there's something that's called we use these measures of word pronunciation, basically, the WTAR, the NART, that give us an index of pre-injury functioning. And we take a whole picture into consideration to try to make that determination. Does that, Leslie, do you want to edit what I've said or add to what I've said?
I think that covers it. Thank you.
So there's a ton of research that's going on, but we're not there yet with biomarkers, so blood biomarkers. But it's been, there's been blood biomarker research that's been going on for many, many years, and we always think we're almost there. But, I do think that we'll get there eventually, and that would be a more definitive marker of concussion or prolonged symptoms of concussion. But again, we don't have it yet. There's nothing that's clinically available. And nothing that differentiates at the single case, the individual level.
Great, thank you. Melina asks, I've been experiencing some memory issues and I wanted to ask what kinds of activities or exercises I can do at home to support my brain function and cognitive health. Are there any daily habits or lifestyle changes you would recommend?
Yes. So there's the whole picture that I've been talking about, but I can tell you about a couple of specific things. So I'll reiterate environmental enrichment. So mentally effortful processing, and you can pull up Brain HQ for that, or you can, as I mentioned, try learning something new. So something that really taxes your mind. and that is continually doing so. So not something that's hard at the beginning, but then is no longer hard. But I would also recommend something called allocentric spatial navigation. So this is so if you're walking around or you're in the passenger seat and you're navigating somewhere, making a mental map of space. So using what we call as allocentric spatial coordinates, which are spatial coordinates that are relative to one another, but not relative to yourself. So for example, if I'm navigating and I'm trying to, my strategy is, okay, when I get to a particular landmark like the bank, I'm going to turn left. And then when I get to the next street, I'm going to turn right. That's self-referential. That stimulates one part of your brain, the caudate, which doesn't help you. But if you make a mental map of space and you make those coordinates of your space that are not self-referential, and that's called allocentric, that is really good for the memory structures of the brain. That stimulates the hippocampus. We have created actually a platform for that, and and so stimulating those areas is and so stimulating the hippocampus is associated with improving memory function. So we have a program, we have a platform, and it's just experimental. We have some initial data on it that look promising, but I could offer it to people to use it, but I can't make any promises of whether it would be effective. But if people are interested in trying that, they can get in touch with me. What's the best way? Via Christian, or I guess I can put my email in. I'm going to put my admin assistant's email in the chat. So yeah, though that's probably the best suggestion that I have for you for memory functioning. Slow pace breathing might have an impact, and then again focusing on attentional functioning and improving attentional functioning. And you may have already examined this, but you might want to consider whether the problems with your memory are really primary memory problems, which in the case of concussion is really unlikely to be the case, or whether the problems are secondary to attention, in which case focus on attention and focus on the things that influence your attention. So if you're really having to rely on your memory, or if you need to learn something new, try to adjust the environment that optimizes your attentional functioning, external and internal. So your internal environment matters too. Oh, I just realized, I just see a question above about the vagus nerve that I forgot to respond to. I think that's everything probably for memory. And I don't have much that I can tell you about stimulating the vagus nerve. I don't know of data on efficacy of stimulating the vagus nerve for improving cognitive function. I think it's a really interesting and promising area of research. So I don't think we have the data yet that support it, but I think anything that has any kind of promise or any kind of anecdotal evidence that does not cause you any harm, physical or financial, why not give it a try? See if it works for you. And even if it works through a placebo effect, who cares?
Mm-hmm. Okay. All right. We've got just tons of questions flooding in here. So, would it be possible to present or reference the research study that found mindfulness as a useful tool for managing concussions?
Can we clock that, and I'll give you a paper that you can
Sure. Yeah.
provide?
Yeah. Yeah. Um, okay. As someone who had a concussion as a teenager and has dealt with symptoms for 20 years, I'm wondering if it's too late for me to make any progress in terms of cognitive function and symptoms.
You know, So a couple of things. We run a tele-rehab center, and we see people who are sometimes decades after their injury, so their concussion. And so I absolutely do not think that it's ever too late, especially because, there are always, I mean, there's kind of two principles that you can think about. If you're talking specifically about concussion symptoms, there's restoration of functioning, where we change the brain and change it back to how it was. And then there's compensation, and that's where we're using new strategies to accomplish the same thing. And when it comes to cognitive symptoms, so 20 years later, can you change the brain in a beneficial way and restore it to how it was? Well, there is evidence that you can change the brain. So mindfulness meditation increases the thickness of the cortex of the brain. It changes the functioning of the amygdala, which affects your negative emotions and helps you to regulate your emotions better. Um, and Allocentric spatial navigation has evidence for changing the hippocampi of the brain, and environmental enrichment or cognitive environmental enrichment and physical exercise both have the capacity to influence the production of neurons in the brain, the proliferation of new neurons and the integration of those neurons into the brain, and influence neuroplasticity. So I think you can. Yes, I definitely think there's potential to improve things decades after a concussion. And if you consider that, you can optimize an uninjured brain, then certainly you can optimize a brain that has sustained concussions.
Mm-hmm.
And then I'll just, reiterate that vicious cycle of concussion, you know, thinking about all of those other things that can indirectly affect your cognitive functioning that you can try to optimize.
Great, thank you. And just a reminder, there were some questions just about the presentation. So this will be archived on the Canadian Concussion Center website. It usually goes up about a week after the talk. Christian has also indicated that we can actually share papers sort of alongside the talk. So for anyone that's looking for that. Okay. Are you aware of any evidence for using specific supplements to help with cognition, such as omega-3s, B complex, magnesium, creatinine?
So, yes, I don't think the data are great yet. That doesn't mean that they don't have an impact. I just don't think we have great evidence as yet on, but where there, is. So I think a good principle to think of is inflammation, neuroinflammation, and or one important principle. And there's growing evidence that an anti-inflammatory diet can influence inflammation in the brain and thereby enhance cognitive functioning. And so the diet that's recommended is the Mediterranean diet, and then there's I believe it's the DASH diet that you can Google.
Mm-hmm.
So kind of by extension, if diet is influencing brain function, then certainly by extension, these supplements that contain some of the same, like alpha omega fatty acids, some of the same contents of the diet, or that can contribute to reduced neuroinflammation, for example, should influence brain function. I don't want to recommend. I know that there are MDs and other practitioners that recommend specific other supplements, but I wouldn't want to recommend them myself. But I am not suggesting that they don't work. Again, um, if there's anecdotal evidence and you're talking about trying a supplement in a recommended dosage, I think that there's no harm in giving it a shot,
Hmm. Great.
taking
Yeah,
into consideration any other medications you may be on and any interactions that there might be.
for sure. And yeah, I know there was a bit of a discussion with regard to diet, I think maybe in the chat. Baycrest actually has a really kind of very clear, simple brain health food guide, which, directs you, how much of different things you should be having. So that's something that you can look up, and it's just like a 1 to 2 page handout that can
They're
be
the people that
helpful.
they're the people that did some of that original research on
Mm,
diet and anti-inflammation.
great. Okay, I am just conscious of time. Can post-concussive autonomic dysregulation impact cognition? If so, what is the best way to approach recovery, especially when diverse care providers may not be fully interconnected?
So we do think that so part of the thinking behind subthreshold exercise is tied exactly to that. So it's tied to autonomic dysfunction and disruptions of heart rate variability, which may be in turn tied to the way that blood vessels and the brain cells or neurons communicate with each other. Um, so subthreshold. So the answer to your question of what you can do is again comes back to subthreshold exercise or any exercise. But I would also add slow-paced breathing is something to consider because the there is evidence for improved cognitive function that is thought to be that may be mediated by heart rate variability. So improvements in heart rate variability. So it logically follows that even though it hasn't been looked at in concussion, that it stands to improve functioning in concussion. And we're planning, in fact, to do a study on that.
Great. Thank you very much. Okay, I think we are going to have to cut it off there. There have been so many questions. I think a record. Thank you so much, Dr. Green, for the excellent presentation and addressing all of these questions. Just a reminder, so you can find this on the Canadian Concussion Center website, uh, probably in about a week or so. We will be back here in 2 weeks. We're going to have Dr. David Gold with us, another neuropsychologist, and who's going to be talking more specifically about neuropsychological assessment. Christian has just posted Dr. Green's assistant's email again. And just a reminder, there will be a very short survey coming your way. And we always really appreciate getting your feedback. And I know that I apologize, there were a number of questions that we just couldn't get to. You're more than welcome to include those in your survey. If you want us to get back to you directly, just include your email because the survey is anonymous, so we don't actually know unless you indicate where it's coming from. So thanks again, and I hope everybody has a great night.